So what do we do if someone has a seizure? The first thing is to make sure that they prevent themselves from injuring themselves even more. So make sure sharp objects and things are away from them. Usually I tell people to lay them down on their side. Pay attention to the length of the seizure because that becomes important as to when to call 911. Do not hold or restrain the patient. In the old, there was this, at some part of time people thought that people could swallow their tongue, but that's not true. In fact, most people who would try to hold someone's tongue would get their fingers bit off rather than someone actually swallowing their tongue. The main risk is for aspiration, so the fluids that you can't swallow might go into your lungs, so lay someone on their side so those fluids can go out of their mouth and not back into the lungs. And if a seizure does not stop within 5 minutes, it's time to call 911. Because seizures that last greater than 5 minutes have a harder time of stopping on their own and many times require IV medications. This condition is called status epilepticus, and it's either 30 minutes of continuous seizure activity or 3 seizures with 1 hour without someone coming back to themselves. And we never tell people to wait 30 minutes. If it's in that 5-minute mark, the suggestion that their brain will keep seizing without IV medications is high. So never wait that long, but that's the actual definition of status epilepticus. And really, failure to have urgent treatment at this point will result in brain damage or death. For example, in studies that looked at status epilepticus lasting longer than an hour, it carries a mortality rate of 32%. And the mortality rate is much shorter if it's stopped and caught earlier in the time period. And just a couple of other things to touch on. In New Jersey, in the state of New Jersey, there's a 1-year restriction for driving when there's been a loss of consciousness with seizures. And in general, safety, I mean, that's the most important thing. When people have a breakthrough seizure, we want to caution them that, we already talked about driving, but other things. Not taking baths when there's not anyone in the house because there's a higher risk of drowning, not climbing on high ladders because if you were to fall and have a seizure, that would be extremely dangerous, not operating heavy machinery if someone were to have a seizure while operating a lawnmower or snowblower. Sometimes, cooking, for example, people have seizures and they have a pot of boiling water and you see them with forearm burns. These are all not uncommon situations, unfortunately. And these are some good resources for anyone interested in learning more about seizures: the American Epilepsy Society, the Epilepsy Foundation, and then the International League Against Epilepsy. So thank you so much. That's all I have for now. And if you have any questions, comments, I'm available.